Hi, my name is Summer Miller, and I'm going to do a presentation for Transcultural Nursing at McKendree University. The topic of my presentation is how to provide end-of-life care for three different cultures: the Asian Indians, the Chinese, and the Japanese. The first thing I would like to discuss is the similarities between the groups. I do tend to find that with these groups there is a small amount of knowledge when it comes to utilizing end-of-life services such as palliative care or hospice. Another thing I found out that they are all similar in their belief that death is a phase of life, and it is inevitable. And the last thing I found in the similarities is that the groups, they tend to let their families or their doctors make their decisions for them when it comes to end of life. The next thing I'm going to discuss are the differences I found between the groups, some of them. The first one is that I found with most Asian Indians, they believe death is like a rebirth, a phase into the next life. With the Chinese people, I found that they are very scared to even think or talk about death, and they're afraid it's going to bring some bad luck to them. And the last thing I found was that the Japanese people are very historical, and they tend to worship their ancestors and do not want to bring shame or dishonor to them. The first group I'm going to bring detailed information about is the Asian Indians and what they are accustomed to with end-of-life care. First of all, there are different beliefs of spirituality within the group, but the majority of them believe in Hinduism. And with that religion, they want to strive for that good death, that good karma. With karma, we know that it's basically if you do something good, then something good comes back to you, and vice versa. So you have to be held responsible for your actions. Another thing with the Asian Indian group is that they do not want to take medications that can alter their mind process. Whenever they're trying to transition into that next phase of life, they want to have a clear mind. So we have to be aware of that. And another thing is that they are very family oriented. They do like to have a lot of gathering of family members around, which also could include a guru or a priest, depending on their beliefs. As they're deteriorating in their life, they may choose to start refusing meals. And once they start that, then they might also start increasing their meditation and their prayer. Whenever, even if they're suffering or having pain, they might want to just meditate and pray instead. They're trying to clear their mind and try to be at peace with themselves as they transition onto that next phase they believe in. And with that, there's the last thing. They might want to find a needy organization or charity of some sort to provide them with a donation. This helps them to feel they have done their one last good deed before they pass away. The next thing I'm going to talk about is some interventions that I came up with to provide care. Definitely we want to respect their beliefs and what they, their spirituality and how they approach death and the end of life. And that way we can definitely incorporate their wishes for how to be taken care of. If they choose not to have any medications such as opiates that might, alter their mind process, then we need to provide some other forms of non-pharmacological care, such as massage or touch or music that can help with pain relief. With the families that are very large, we're going to have to go ahead and provide some room for them. And also, we need to be respectful and allow that extra time for meditation and prayer as they, get closer to the end of life. And the last thing is, if they are requesting us to help them, we should be able to find them a religious leader of some sort and go ahead and involve our, ethics group or our cultural groups in our hospitals to, help us with that and get that in place.